As I mentioned earlier, we're going to be chatting a little bit about influenza because, of course, it's the season, test the season, as they say. And this morning, I want to welcome via Zoom some representatives from the Ministry of Health, specifically Primary Care Physician 2 of the Southwest Regional Health Authority, Dr. Melissa Bechan, and Primary Care Nurse Manager at the same, Nurse Catherine Elborn. Good morning to you, ladies.
Good morning, everyone.
Welcome to the show. Now we know it's influenza season, sorry. And let's get into firstly. Let me start with you, Dr. Bechan. Can you describe for us what exactly is influenza?
So, influenza is a viral type illness, right? So it's similar to the common cold. However, it's a little more severe than the common cold. So, the symptoms of the influenza virus are cough, runny nose, sore throat. Some persons may get vomiting, diarrhea, and depends on the age of the person, the existence of comorbidities. The symptoms may become more severe. So it's the influenza season, as you said, it's upon us, and we need to take precautions to really prevent infection, not only for ourselves, but for our loved ones, our kids, the elderly, because a lot of times the influenza virus is transmitted via droplets. So it means that if someone has symptoms and they cough, the persons that are in close proximity of them have a risk of getting the virus because that's how it's transmitted.
Okay,
Yeah.
understood. Nurse Elborn, tell me about the impact that influenza has on the community and the environment on people.
So you find that in terms of, as Dr. Beechan would have mentioned, your risk of contracting the virus, we have at least documented figures for coming out of the World Health Organization, where as much as 500,000 persons die every year as a result of the influenza virus. As such, we have always taken the forefront of ensuring that we have the vaccines available, which is one of our first precautionary measure in terms of building person's immune system so that they do not contract the virus. And even if they do, it will limit the risk of them becoming severely ill. I mean, last year we would have had 950 cases of influenza, of which we had 5 deaths. And I mean, when you look at 950 cases, you would say, okay, 5 deaths is a small number, but 5 deaths is five too many, even one, because this means that persons would have lost their loved ones and the impact that it would have had on families. So, therefore, as much as feasibly possible, the Ministry of Health tries to preempt those deaths by safeguarding the population through our vaccine programs.
All right, so let's get into the vaccine program a little bit. Doc, I understand that there are 4 parts to this vaccine.
4 parts
Well, they
to
say
the
in here,
vaccine.
yeah, that it contains 4 strains of the influenza virus in the vaccine.
Okay, right. So yes, so the vaccine itself, if every year there's a new vaccine, new influenza vaccine,
Right.
right? That's out, and yes, there are multiple strains of the virus in the vaccine. The reason for that is the strain that is most common in the environment at that moment is the one that you'll find in the vaccine. Hence, it's updated every year because the strains change. Yes?
Yeah.
So every year there's a new vaccine. So that's the importance of persons taking the vaccine every year because they need to have the immunity, to gain the immunity of the new strains in the environment.
And people, ever since COVID-19, everybody's been all up in arms about vaccines and vaccines, even though we've been taking especially this influenza vaccine yearly since, I don't even know, since I'm a little boy, I've been hearing about this influenza vaccine every single year. What would you say to persons who are still doubting whether or not the vaccine is safe?
Well, the vaccines itself, I mean, our history, as you said, we've been taking vaccines for a very long time. And let's just take, for example, the COVID vaccine. Currently, right now, the low cases that we're seeing in our nation is proof that the past drives with taking the COVID vaccine, right? It shows that we have a good level of immunity in our population, right? And also, as Ms. Elbon just said, the cases that we're seeing with regards to the influenza in the past, let's say in the past, in last year, right? Um, yes, it was 950 cases, yes, in a population of, let's say, 1.3, 1.4 million. That seems, as much as we do, the deaths were associated with it were quote unquote low, right? So I mean, it does give a gesture as to, okay, the past, the vaccination drives and all these things that we've been doing in the past have been working.
Yeah,
Right.
most definitely.
And I mean, other than for sure. And other than the vaccine, what is encouraged to prevent the spread of the virus is taking the necessary precautions, such as, I mean, during the COVID pandemic, everywhere, wash your hands, right? Using soap and water, sanitizer, right? And, taking these simple yet really, really important precautions would help to reduce the spread as well.
Most definitely. Nurse Elbon, tell me, where can we get the vaccine?
The vaccines are currently available at all our local health centers. So you can go to any one of the health centers nearest you and have access to the vaccine.
Yeah. Now, some persons might be watching this and saying, well, I might be young and strong, or I'm fit and healthy, and I don't need to get this influenza vaccine because my immune system will be able to handle it. Tell me some of the people who are considered to be high risk when it comes to influenza.
When it comes to influenza, we have persons who are immunocompromised, people who are sickle cell, people with HIV, etc. Those persons need to be vaccinated. We have persons with the non-communicable diseases, which is things like your diabetes, your hypertension, persons with respiratory problems, which is like asthma. And we also have the pregnant woman, which is important, and children from 6 months to 5 years, and persons over the age of 65. So these are all considered our vulnerable population, and therefore it is imperative that they be vaccinated.
Dr. Bechan, is it safe for pregnant women to take this vaccine and for children as well?
Yes, it is. It is very safe for pregnant women and children to take the vaccine, especially because they are identified as that high risk population with regards to being immune. The risk of having the infection can have severe. Let's say a pregnant woman getting influenza in her pregnancy has severe risk to herself and her baby, right?
Yeah.
And even children, because they are classified as they are known, their immune system are not as developed as an adult. They are at a higher risk of having more severe symptoms and having risk of hospitalization due to influenza.
Yeah. Ms. Albon, if I get the vaccine, right, can I still contract influenza, or am I safe from getting it once I take the vaccine?
Well, if you get the vaccine, chances are that you may or may not contract the virus. Remember, what we said is that it gives persons a fighting chance if they contract the disease, but it does not prevent you from, because remember, these things are different strains, does not prevent you. But that is, not very common. Most
Right.
persons don't really get the virus having had the vaccine. It's not
All
as
right,
common.
nice. But tell me about how you guys treat patients who come in with influenza. What's the treatment process like? Ms. Albon?
Is that
Oh, you can go ahead, Doc. You can go ahead,
So
Doc.
my take on it would be that the symptoms, once it is mild, you you go through your necessary precautions in terms of your safety, protecting yourself from others, so that they don't contract. And if it is, you figure that the symptoms, because sometimes it lasts very long, then what I would say is seek your medical intervention, where
Yeah.
Dr. Beechan comes in.
Yeah, Dr. Bechan, what's the medical attention that they would need?
Right. So if a patient presents to us, let's say in the health center, with symptoms that are familiar to be known to be associated with influenza, so the cough, sore throat, I get vomiting, diarrhea, in situations where it may be a little more severe, right? So yes, if the symptoms are mild, and after a thorough history and examination, the patient is well. Patient would be sent home with guidelines, treatment for fever, Panadol, lots of fluids, rest, isolating themselves from maybe other persons in the home, especially if you have children, if you have persons over the age of 65, persons with comorbidities, because remember, we don't want to risk spreading the virus to those persons who are considered immunocompromised.
Yeah,
Yes,
most definitely. All right.
right, and
Well,
yeah. So
ladies,
for persons who have, sorry,
Go ahead.
for
No, you
persons
go
who have
ahead.
more
'Cause
severe for persons who have more severe symptoms on when doctor sees, then we would refer for further care. So if a person has severe cough where they can't breathe, having shortness of breath, those sort of symptoms, they're referred to a secondary care location like a hospital to get X-ray, to get blood tests, and further investigations.
All right, so we want to avoid all that and just go get the absolutely free vaccine that's available at all health centers. Ladies, thank you so much for joining us this morning. Do enjoy the rest of your day, and good luck with all the people coming in to get vaccinated.
You're welcome. Thanks for having us.
Not a problem. Enjoy your day. Take care. That is Dr. Melissa Bechan and Nurse Kathy Ann Elborn, representing the Southwest Regional Health Authority, just encouraging us to go out there and get that influenza vaccine. Of course, don't forget, influenza season runs from October to May. So you want to get those vaccines soon. They're available. They actually became available from yesterday at all health centers around the nation. We take a quick break and come back with more inside the Now Morning Show. Stick around.